Candida is a yeast that lives naturally in your gut, skin, and mucous membranes, and in small amounts it causes no problems. But when conditions shift, after antibiotics, with a high-sugar diet, with a compromised immune system, it can overgrow dramatically. Research shows that Candida overgrowth is associated with chronic fatigue, digestive disturbances, brain fog, recurring infections, and skin problems. The good news is that the same research that documents the problem also maps the solution. A study published in Infection and Immunity demonstrated that feeding laboratory animals a sugar-rich diet produced dramatic increases in intestinal Candida colonization, while animals on a standard diet maintained normal low-level Candida presence. Removing dietary sugar reversed the overgrowth. The mechanism is direct. Candida uses glucose as its primary energy source and ferments it to grow rapidly. Your dietary choices are either feeding or starving this organism. This video draws on clinical infectious disease guidelines and microbiology research. The 2009 Clinical Infectious Diseases Guidelines by Pappas and colleagues are the authoritative clinical reference on candidiasis management. A 2014 review examined evidence for natural antifungal agents against Candida. Jawara and Morden's 2004 paper documented the dietary sugar-Candida connection mechanistically. And Mukherjee and colleagues studied caprylic acid, a natural fatty acid, against Candida biofilm formation. A common misconception is that Candida overgrowth is primarily a vaginal infection problem affecting only women. In reality, Candida can overgrow in the gastrointestinal tract, the oral cavity, as thrush, the skin, and systemically in immunocompromised individuals. Research shows that intestinal Candida overgrowth is associated with irritable bowel symptoms, chronic bloating, brain fog, and fatigue. Many people live with untreated intestinal Candida overgrowth for years without realizing the organism is the underlying driver of their symptoms. Understanding why Candida overgrows requires understanding the conditions that allow it to proliferate. Your gut microbiome normally keeps Candida in check. Beneficial bacteria compete with Candida for resources and produce substances that inhibit its growth. When antibiotics kill beneficial bacteria, Candida fills the ecological void rapidly. A high-sugar diet fuels Candida's rapid reproduction. Immune suppression, from stress, poor sleep, or medical conditions, removes a major check on Candida expansion. Research has documented a striking contrast between two gut environments. A gut with a diverse, healthy microbiome, fed by fiber, fermented foods, and low sugar, maintains Candida at normal, non-problematic levels. A gut with disrupted microbiome, fed by refined sugars and low fiber, allows Candida to shift from its benign yeast form to a more invasive hyphal form, with thread-like filaments that penetrate gut lining. Clinical Infectious Diseases Guidelines define the gold standard for Candida diagnosis and treatment. Beyond drug treatment, research supports dietary and microbiome-based approaches for chronic or recurrent candidiasis. The 2014 Evidence-Based Complementary Medicine Review analyzed 15 natural compounds with documented antifungal activity against Candida. Caprylic acid, a medium-chain fatty acid found in coconut oil, showed particularly strong in vitro activity against Candida, including inhibiting biofilm formation. Probiotics have documented research support for preventing and reducing Candida overgrowth. The mechanisms are multiple. Beneficial lactobacillus and bifidobacterium species produce lactic acid and hydrogen peroxide that create an environment hostile to Candida. They compete for adhesion sites on intestinal cells, blocking Candida attachment. They enhance immune responses against fungal invasion. Research shows that probiotic supplementation after antibiotics significantly reduces Candida colonization compared to no probiotic use. Research on antifungal dietary strategies shows that removing dietary sugars is the foundation of any effective protocol. Candida's metabolic dependency on glucose means that sugar restriction essentially starves the organism. Studies also show that certain foods have documented antifungal properties. Garlic's allicin compound disrupts Candida cell membranes. Coconut oil's caprylic acid penetrates and disrupts Candida biofilms. Apple cider vinegar creates an acidic environment unfavorable to Candida. These are not folklore, they are mechanisms studied in antimicrobial research. Candida produces toxins and byproducts of its fermentation that research has linked to systemic symptoms. Acetaldehyde, produced during Candida's metabolism of sugar, is the same compound produced during alcohol metabolism and is known to impair brain function. This may explain the brain fog frequently reported by people with Candida overgrowth. Candida also produces gliotoxin, which suppresses immune cell activity, and various proteins that can increase intestinal permeability. The evidence-based protocol for eliminating Candida overgrowth works in 3 sequential phases. Phase 1 is removal. Starve and kill the Candida by eliminating dietary sugars, refined carbohydrates, and fermented alcohol while adding antifungal foods like garlic and caprylic acid sources. Phase 2 is restoration. Rebuild the beneficial microbiome with probiotic-rich fermented foods and probiotic supplementation, creating competitive pressure against Candida regrowth. Research on Candida treatment timelines shows that symptom improvement follows a predictable course when the protocol is followed consistently. In the first week, some people experience die-off reactions, temporary worsening of symptoms as Candida is killed and releases toxins. This is normal and typically resolves within a week. By weeks 2 to 4, digestive symptoms, bloating, gas, discomfort, measurably improve. Cognitive symptoms like brain fog often clear in weeks 2 to 6. Based on the research, here are the specific steps with the strongest support. Eliminate all added sugar, high fructose foods, and refined carbohydrates for at least 4 weeks. This is non-negotiable. Add raw or cooked garlic daily, 1 to 2 cloves. Include coconut oil in cooking for caprylic acid content. Add a high-potency probiotic supplement with Lactobacillus acidophilus and Bifidobacterium longum. Eat fermented foods daily, plain yogurt, kefir, sauerkraut, or kimchi. The research logic for Candida elimination is clear. If you continue eating high-sugar foods while adding antifungal measures, then you are simultaneously feeding and attacking Candida. The net effect is minimal. If you eliminate sugar and add probiotics, then Candida loses its fuel source while beneficial bacteria repopulate to fill the ecological space. If you experience die-off symptoms in week 1, then this is a normal sign that the protocol is working. Maintain course and support detoxification with. Candida overgrowth is a real, research-documented condition, not a wellness myth. It is driven by sugar, disrupted microbiome, and immune suppression. The protocol to reverse it is systematic. Remove the fuel, add antifungal compounds, restore the beneficial microbiome, and maintain the conditions that prevent recurrence. Research confirms that each step has a specific mechanism. The protocol works when all 3 phases are followed completely. If the symptoms described today resonated, the chronic bloating, the brain fog, the recurring infections, consider whether Candida overgrowth could be a factor. The first step is dietary. Remove sugar and refined carbohydrates for 4 weeks and observe. Add a quality probiotic. Introduce garlic daily. These are safe, research-informed steps with no meaningful downside. If symptoms are severe or persistent, a healthcare provider can order tests including urine arabinitol to assess Candida status objectively.